Welcome to this explainer. I am absolutely thrilled to guide you through today's topic because we're going to take a look at a very familiar subject from a completely unexpected angle. We hear about emotional support animals all the time, right? Usually it's some wild debate about someone trying to, I don't know, sneak an iguana onto an airplane or hide a puppy in a no-pets apartment. But today we're actually looking at the hard data. We're going to uncover how these animal companions are, surprisingly, serving as a hidden but absolutely critical gateway into the American mental health care system. So get ready because this is a major twist on everything you thought you knew. To kick things off, I've just got to ask you, do you actually know the difference between a legitimate ESA evaluation and, well, a flat-out online scam? Because honestly, if you search for an ESA letter online right now, you are literally going to be flooded with these massive corporate letter mills. And the difference between those highly transactional, sketchy websites and real clinical support for housing, it's massive. And as we'll see, it has huge implications, not just for renters getting approved, but for actual patient health. All right, Section 1, the ESA housing debate. Okay, let's dive into this. The landscape of these housing accommodations has just completely shifted recently. Right now, what we're seeing is third-party tech startups essentially acting as middlemen in the healthcare space. These corporate tech mills, they're designed to take your money right up front, and in return, they just spit out these weak, single-use form templates. You're not getting real care, you're just buying a piece of paper. And this practice is incredibly risky. It leaves renters entirely exposed. If a landlord or a corporate housing authority challenges that automated rubber stamp request, the renter is just left to fend for themselves. They're basically fighting to get a refund after their housing accommodation gets completely rejected. Section 2, a nation seeking treatment. Now, to truly understand why people even turn to these online mills in the first place, we have to pivot sharply from apartment pets and look at a massive systemic issue. Based on the latest data from the Substance Abuse and Mental Health Services Administration, SAMHSA, just let this number sink in for a second. 21.4 million. In 2024 alone, 21.4 million adults in the U.S. experienced a major depressive episode. That is a staggeringly huge portion of the population struggling with a severe diagnosable condition that disrupts everything: their daily functioning, their work, their home life. And the data here brilliantly illustrates the true severity of the crisis we're facing. Looking at SAMHSA's numbers for adults struggling with both a mental illness and a substance use disorder, a shocking 41.2% receive absolutely no treatment. Zero. No outpatient care, no telehealth check-ins, no medication. Millions of people are suffering from severe mental illness without receiving any care whatsoever. It's just a massive gap in our system. Moving on to Section 3, mental health provider shortages. So why is this happening? Why are so many people going without treatment? Well, to answer that, we look at the Health Resources and Services Administration. The government officially designates certain regions as HPSAs. That stands for Health Professional Shortage Areas. And millions of Americans currently live in mental health HPSAs. So this isn't just about folks, not wanting to go to therapy. This means that for huge, massive swaths of the population, they physically cannot access a supportive professional even if they desperately want to. The providers simply aren't there. Which brings us to Section 4, evaluations as a gateway. Now, let's completely reframe this entire topic. When we bring the whole ESA housing debate and this national shortage data together, the crucial point is this. An ESA evaluation isn't just about keeping a pet in an apartment. Because of the severe provider shortage, an ESA evaluation is very often someone's very first contact with a licensed mental health provider. This is it. It's a hidden gateway into the mental health care system for people who might otherwise just remain stuck in that untreated 41.2% we saw earlier. This initial contact is just incredibly powerful. It directly bridges the gap for those who don't currently have access to a provider. When someone reaches out for an ESA letter, a real licensed professional can actually assess the clinical impact of human-animal interventions. They evaluate the patient for actual DSM-5 disorders, and most importantly, they can initiate a long-term clinical relationship. This first evaluation helps get people into much-needed ongoing mental health treatment that they likely wouldn't have accessed any other way. It's a total game changer. Section 5, real support versus tech mills. Let's move to and see how this builds, because to actually bridge this gap ethically, individuals absolutely must bypass those corporate tech middlemen. Let's compare the two. Corporate tech mills randomly assign you to independent contractors for a quick one-and-done template. It's a highly transactional risk. On the flip side,
A provider coalition, like the Fair Housing Clinical Network, connects you directly with a dedicated licensed specialist. You see, this isn't a tech startup, it's a relationship model. They provide real, ongoing clinical care and guaranteed legal defensibility if a housing board ever requests verification. Plus, you're pre-screened, meaning you only pay if you legally qualify.
And because these ethical coalitions completely eliminate third-party fees and massive CEO overhead, they can offer direct-to-provider pricing. An initial evaluation meeting with a licensed provider through this kind of model costs just $120. That direct connection is what makes this a true-to-value cost. It puts the resources entirely into patient care rather than lining the pockets of corporate startups.
And these ethical coalitions maintain really strict, rigorous clinical boundaries. Just look at this quote directly from the Fair Housing Clinical Network. It states, "They are actively looking for clients who are prepared to begin treatment. They aren't in the business of making quick cash. They genuinely prioritize real clinical results." By building these bulletproof cases rooted in ongoing treatment, they achieve a 99+% success rate for their clients' housing accommodations. That is huge. So what does this all mean? Well, it brings us to a final provocative thought. Millions of Americans are out there suffering without care in areas completely devoid of mental health professionals. If a simple evaluation for an emotional support animal can serve as this hidden gateway, literally opening the door to life-saving, ongoing mental health treatment, how else should we rethink our entry points into the healthcare system? I mean, it completely changes the way we look at human-animal interventions in an overburdened medical system, doesn't it? Thank you so much for joining me for this explainer, and I really hope it leaves you with a lot to think about.